Hey, do you have high blood pressure, angina pectoris, or atrial fibrillation? Well, I have the drug for you, Diltiazem. Diltiazem is a calcium channel blocker. Inhibits the transportation of calcium into myocardial and vascular smooth muscle cells. This will calm the heart by lowering the heart rate and blood pressure by systemic and coronary vasodilation. Do not take diltiazem if you're allergic to, have a systolic blood pressure of less than 90 millimeters of mercury, have a second or third degree heart block or decompensated heart failure. Don't take diltiazem if you had a recent MI or pulmonary congestion or concurrent use of rifampin. Diltiazem can be either taken by mouth or intravenously. For IV adults, the appropriate dosing is 0.25 milligrams per kg. It may be repeated in 15 minutes with a dose of 0.35 milligrams per kilogram, or may follow with a continuous infusion at 10 milligrams per hour for up to 24 hours. For IV push, you would administer the dose undiluted with a concentration of 5 milligrams per milliliters, slowly over 2 minutes. Diltiazem has a wide-side compatibility for vasopressin, ranitidine, propranolol, potassium chloride, oxytocin, ondansetron, norepinephrine, and naloxone. It is incompatible with allopurinol, diazepam, furosemide, ketorolac, pantoprazole, phenytoin, piperacillin, tazobactam. It is important to monitor blood pressure and pulse prior to, during, and after therapy. It is important to monitor ECGs continuously throughout therapy because it can cause arrhythmias. Therefore, it is important to have emergency equipment and medication readily available. It is important to monitor intake and output ratios and daily weight and assess for signs of heart failure. Also, it may cause Stevens-Johnson syndrome, so assess for rash periodically during therapy. Discontinue if it is severe or accompanied with fever, general malaise, muscle or joint aches, blisters, oral lesions, or hepatitis. Avoid drinking large amounts of grapefruit juice as it increases the levels and effects of diltiazem. Notify a healthcare provider if the heart rate is less than 50 beats per minute or experience an allergic reaction. Change position slowly to minimize orthostatic hypotension, and this may cause drowsiness and dizziness, so avoid doing activities that require a lot of alertness. It is important to encourage good dental hygiene to prevent bleeding and gingival hyperplasia. Other side effects are lightheadedness, constipation, swelling in legs, hypotension, heart failure, syncope, nausea and vomiting, dysuria, nocturia, polyuria, urinary frequency, Stevens-Johnson syndrome, photosensitivity, rash, hyperglycemia, anemia, leukopenia, and weight gain.